Hi, I'm Melissa. I'm one of the estheticians here at Elite Plastic Surgery. Today we're doing a demo on one of the treatments that we do. It's called collagen induction therapy, aka microneedling. So the device that we're going to use is called Skin Pen. And our lovely patient here is Dr. Armstrong. He is one of our board certified plastic surgeons here in the office. And I also have Jackie, who is our Skin Pen rep, and she is going to be doing some of the talking as I'm doing the demo on Dr. Armstrong. So she'll give you the ins and outs of what this treatment can do, who it can treat, what skin type, what skin conditions, and hopefully she'll be able to answer questions that you're thinking as we're doing this treatment. So stay tuned.
You want to just dial in a little closer to Dr. Armstrong so you can actually see what the device is capable of doing. So the Skin Pen microneedling procedure is a pretty comfortable experience. It's a short procedure time, approximately about 30 minutes, and it's a plan for optimal results. The post-procedure effects are similar to a mild to moderate sunburn. So what you're going to see him experiencing is the device actually puncturing his skin and it's putting thousands and thousands of microneedle puncturings into his skin. This treatment is safe for all skin types, light to dark, and it's ideal for any time of the year with little to no downtime that gives you beautiful lasting results. Like I said, this in-office procedure delivers thousands of micro-injuries, and what that does is it initiates the body's own wound healing process. So,
okay?
Does it feel okay?
Yeah.
Okay.
That's fine.
So before we started this, we actually put a numbing agent on so that doctor wouldn't actually feel it. It's very, very comfortable. So when the body's own wound healing process begins, it actually breaks down damaged tissue and then it starts producing healthy new cells. And the cells then remodel the injured tissue, producing organized, healthy dermal tissue such as collagen and elastin. Those are things that start to fail as we age.
No one likes that.
Right.
So you're seeing he's picking up a little bit. That's what we want. And he will have minimal downtime. He'll be red tonight and maybe tomorrow. And that's really about it. So it's a minimal amount of downtime.
Well, and when did you have your last treatment, Melissa?
I had a treatment on Monday morning. And I today don't look like I had anything done. I put makeup on and I'm not red. After the first day and a half, I really wasn't red at all.
So doctor will go home with an at-home topical support called Skin Fuse, and that's the post-microneedling protocol, and it's been specifically formulated for optimized results. And what the Skin Fuse provides is an environment for tissue remodeling, which includes the skin's natural ability to produce collagen and elastin. And without those specific things like vitamins A, C, E, copper peptides, magnesium, and zinc, that would not even be able to take place. So those are very important to have in the wound healing protocol.
I'm going to push on your nose here. It helps with the vibration. So this is really good for pores also.
Yeah, that's one of the biggest things that you're going to notice with this treatment is that texture is going to be a huge, huge change.
Doing okay?
Mm-hmm.
Another thing, when Melissa treats doctor around his eye area, there really isn't another modality on the market that can get as close to that under eye and over eye exposure as the skin can. For those patients that have pitted acne scarring, this is probably the best modality on the market to treat those patients for that scarring.
Alright, go right in your upper lip. Now because of the beard area, let me know if one direction is more uncomfortable than another.
It's looking really good. Do you want me to talk about the skin tube a little bit?
Oh, absolutely.
So, in the skin tube protocol, we have a purifying cleanser, which is actually good for all skin types, whether you're dry or oily. We have our fortified vitamin C serum, which actually acts as a free radical to help keep all the pollutants away. We have our Reclaim, which is our hydrating support, and that's what has our A, E, C, couple peptide magnesium zinc. And then we have what's called Shield, and this is actually one of my very favorite part of the protocol because it has a 21% zinc oxide, so you're going to get complete coverage. And when you hear 21% zinc oxide, most people think right away that it's going to be white and sticky, but this one's not. It's tinted with melanin, so it's chemical free, and it's almost like a BB cream. It's very soothing, very soothing, and it's got an SPF of 30, so it's 100% complete coverage, and it's just really nice. And it's going to last 90 days. This protocol lasts for 90 days.
So when you have these treatments, we schedule them in a series of 3, about 4 weeks apart.
Correct. That's where you're going to get your wow factor.
Doing okay?
Mm-hmm.
Everybody's different. There are some of those patients that may need more than 3 treatments, especially those patients that have that pitted acne scarring. But that's between, the patient and the practitioner.
We'll move on to the cheeks over here.
You can do them by
I usually do that way.
Oh,
I can do it first, I guess. Alright, so we'll move on under his eyes. Okay? Did you figure it was good for all skin types? And
oh yeah, I did. I think for all skin types, light and dark, light and dark skin, and all seasons.
alright, flip you over here, onto the cheeks. Doing okay? So to find out if you are a candidate for this procedure, you could come in and have a consultation with myself, Melissa, or Stephanie, who is our other esthetician. And we do the different types of peels, skincare products, and we do the evaluations and talk to you about what you're hoping to treat with your skin. Do you have any questions, Dr. Armstrong?
What should I expect as far as the post-recovery protocol? You mentioned not shaving tomorrow.
Yes, if you can take 24 hours off of shaving, especially if you use a blade, we don't want to exfoliate that skin really when it's before it's ready. So you don't want to have any extra irritation.
And you will go home with the 90-day skin fuse post-procedure protocol. So On the inside, it's pretty self-explanatory. It has steps 1 through 5, and it has an AM and PM. And it tells you exactly how to use everything that's in it.
And I would say no excess sweating, so no running tonight.
Yeah, you can't, yeah.
You want to give that a good 24 hours before you do that.
Okay.
You look discouraged.
Just go home and sit on the couch and relax. Alright, on to this last side here. Feeling all right?
Yeah.
Not sick of it yet, right?
No.
You can also do it if you want to.
Oh, that's great. Just that part over a little bit. That feel there a little bit. Perfect. So Jackie mentioned that a sunscreen also comes in this kit, but being an esthetician, this is always my motto that you always want to wear sunscreen regardless. If you're having this treatment or another treatment or just want to keep your skin looking good. You know, these treatments that we do, whether it's this or chemical peels, we're trying to correct your skin. And if you're not preventing new damage from happening every day by wearing sunscreen, antioxidants, you're kind of shooting yourself in the foot. So you gain much more ground and keep your skin looking nicer if you're using sunscreen every single day, even if there's no sun. If it's daylight, you need it. So that's always a good thing to remember. Still doing okay?
Yep.
On a scale of 1 to 10, where do you put yourself as far as the being discomfort?
Oh, 1.
I want good.
Yeah. I think the most sensitive parts for me were under the eyes.
Under the eyes? Okay.
All right. We are finished with this treatment. Those are scratchy though.
Oh.
Now, how's your skin feel now that I'm done? Does it feel a little bit spicy in a couple of areas?
Yeah, it's largely numb, but it is kind of tight.
Hey, that's a good thing.
Yeah.
So you can see Dr. Armstrong is a little pink, a little pinker in certain areas, but that's totally normal. Like I said, he'll stay like this tonight. Might be a little bit more red as he gets moving around. Tomorrow maybe a little bit blotchy, but really not a whole lot of downtime. He might get a little bit of flakiness in a couple of days, but that's good. And then we'll see him again in 4 weeks for another treatment. Thank you. Yeah, thank you.